my name is Amy, and I'm a student nurse at the University of Manitoba, and I will be demonstrating how to reconstitute a drug in a mini bag. So first, I'll start with hand hygiene. So normally I would do my first med check at the Pyxis machine, but for the purposes of this video, I'll do it right here. So I have my Zithromax, so that is the right drug, for Mr. John Smith, who's the person. My dose is 400 milligrams. It is to be given through IV, and it is given daily, and right now it is 0900. He has no known allergies, and he has a UTI, and this is an antibiotic, therefore it is the right reason. So now I'm going to go look at my drug parentile monograph, and it says that a student nurse is allowed to administer this, so I know that I can. And the maximum single dose is 500 milligrams, and I'm giving 400, therefore I know it'll be a safe dose. So as this is a powder, I will need to reconstitute. So for a 500 milligram vial, which I have, I need to add 4.8 milliliters of sterile water for injection, which then gives me a final volume of 5 milliliters and a final concentration of 100 milligrams per milliliter. So I'm going to start that. So I'm going to grab my 10 ml syringe so that I have more room to draw up my dose.
Now I'm taking my syringe and I'm getting 4 ml of air.
And now I'm going to swab my sterile water to make sure that I'm getting rid of all the bacteria. I'm going to do that for 30 seconds and let it dry for 15. And then I'm going to swab my Zithromax for 30 seconds and let that dry for 15. So now I'm ready to withdraw my sterile water, so I'm going to get 4.8 milliliters of air. So I'm going to inject that into my sterile water.
Now I am just recapping that.
And now I am going to withdraw.
Now I'm just going to be labeling my drug here. So the patient's name is Brittany Spears. The drug name is.
So I'm just going to make sure that I'm getting rid of all the bubbles.
400 milligrams. The volume is 4. And then the date. And I ensure that.
So now I'm going to inject this into my already clean vial of Zithromax.
And now I'm going to be completing my second check. So I have my patient, Brittany.
So now I am going to slowly roll this in my hands to make sure that I am mixing it all together.
The dose ordered is 400 milligrams. I have 400 milligrams.
Now I'm just going to check. Yes, it's good. It's all together. So now I am going to calculate my dose to draw. So I know that my dose is 400 milligrams and the final concentration is 100 milligrams per ml. So I'm going to do 400 divided by 100 milligrams times 1 ml, which means I'm drawing up 4 mLs. So I am going to draw up 4 mLs of air.
250 mLs. So I already have my mini bag.
And I'm just going to re-swab my Zithromax. I'm going to do this for 30 seconds. Let it dry for 15. I'm going to insert the 4 milliliters of air and withdraw.
And maintaining sterility.
Making sure that I'm getting rid of all the bubbles.
And then I am just passing the bag.
Good, so I have my 4 mLs.
Now
I'm just going to recap.
my label for the
So now, before I dilute, I'm just going to do my second med check. So I know it is for John Smith, so right patient, I have Zithromax, right drug, 400 milligrams, it is going through IV, and it is given daily at 0900. So, and it is an antibiotic, he has a UTI, right reason. So now I'm going to look at my parenteral monograph to see what I can dilute it in, and it says I can dilute the dose in 250 mLs or 500 mLs of D5W, normal saline, or dextrose saline solutions and infuse over 1 hour. So I have chosen normal saline, the 250 milliliters. I've chosen this because he already has a primary infusion of normal saline, so I know it is compatible, and I'm choosing the 250 milliliters because he is also on a fluid restriction. So now what I'm going to do is I am going to swab the port for 30 seconds.
I'm just rewashing my hands.
And inserting my needle. And inserting.
My name is Sarah. I'm here today administering your antibiotic.
Good. Now I'm just going to gently rotate the bag to make sure that everything is mixing together.
The IV site is already running.
So now I'm going to make a label. And
I'm also looking at the site here.
here we go. And I'm going to write the patient's name. And I'm going to write the dose and the drug. So the drug is Zithromax. I'm giving 400 milligrams. The total volume is 254 mLs. And I'm going to put the date I'm giving it, the time, and I'm going to sign it. So I'm going to label the bag, and I'm going to make sure that so that other healthcare providers know what medication is being administered. And I'm going to make sure I put it on a part of the bag that isn't covering any important information. So now that I have that, I am ready to go into the patient's room. So I am going to grab my mini bag, my IV set, alcohol swab, and my MAR. So prior to entering the room, I'm going to make sure that I perform hand hygiene. Good. I'm going to grab my hands. There we go. So now I'm going to enter the room.
And I am just swabbing the port for 30 seconds and I'll
Good morning, Mr. Smith. My name is Amy, and I'll be your student nurse today. I'm here to give you your antibiotics. And as I was entering the room, I was also performing a safety check, making sure that his call bell was in reach, that his head, the height of the bed is at a safe height, and just doing an overall inspection. I'm just going to ask you a few questions. Can you tell me your name? Good. Can you tell me your date of birth? Perfect. And now I'm just going to inspect the site, and there is no redness or inflammation or phlebitis. Do you feel any pain? Good. No. And his IV is running, therefore I know that his IV is patent. So now I'm going to do my third med check at the bedside. So no, I know this is John Smith, and this is Zithromax. I'm giving 400 milligrams IV daily at 900. So before I set things up, Mr. Smith, I would just like to let you know that this can cause some abdominal pain, you can experience some nausea or some diarrhea. So if you're experiencing any of those, please don't hesitate to use your call bell and let me know. So now, I am going to get ready to set up my tubing. So I am going to hang the primary line lower, and the secondary line will be higher, so that because that is the one that wants to be run first. Now I'm just going to get my tubing out.
I'm putting in 250 so that allows me enough time to come back.
I'm going to make sure that my clamp is closed. Good. And I am going to get ready to spike the bag.
So I have your antibiotics.
So making sure that everything is sterile.
Nausea, vomiting, and diarrhea. So let me know if you want. We're going to do our second
So I'm spiking the bag. Good. And now I am going to swab the port that is above the Baxter pump because this medication is going to be run through the Baxter pump. So I'm going to swab the port for 30 seconds, let it dry, and maintaining sterility. I'm going to touch the line. Good. Now I need to back prime my line, so I'm going to hold this lower than the primary set, and I'm going to undo my clamp, making sure that there's too much, so I'm just going to make sure that there's only a third to halfway full here. So now I am going to get ready to do my rate. So I know that I have 254 mLs in here and I need to run it over an hour. So I'm going to program my secondary rate to 254 milliliters per hour. And now, before I press start, Mr. Smith also has the right to refuse at any point in time during this process. So now I'm going to press start. And now I know it's running, so I'm going to check to make sure that I see 3 drops. So I do see 3 drops so that I know it is running at the right rate. So now, just before I leave, I'm also going to label the line. And I'm going to put my date, my name, and the time that it was put on, and the date, so that other healthcare professionals know when to change the line. And finally, I am going to make sure that I document it on the MAR, and then I am going to come back and check on Mr. Smith later. And that is how you reconstitute a drug.